So in this video, I'm going to show you how to potentially identify sacroiliac joint pain and how to self-treat it. So if you have a sacroiliac joint issue, most of the time it's on only one side. So these big sacroiliac joints run from these bony prominences that stick out at the very bottom of your back, and then they run through the glutes through here. And you'll often feel like there's more pain if you're arching. So if you're doing this, extending your back, if you're kneeling like I am, or standing and you're feeling a sharp pain on one side, then potentially you have a sacroiliac joint issue. And I like to recommend to all my clients that have sacroiliac joint issues that they wear a belt specific to treat this issue. And you can also do a self-test at home to see if a belt will be helpful for you, where do that extending movement again and push on the bones at the front of your pelvis. So these two bones that stick out here, push them together, and that's mimicking the belt. And then if you arch with applying that pressure, if there's less pain, then that's something that will be a useful tool for you to help minimize flare-ups in the sacroiliac joint while you're recovering. So we'll first go over exercises. And there's three that I really like that help stabilize the joints due to strengthening the muscles. And I think people get into trouble a lot because they overstretch, they get a lot of hands-on treatment, but they don't really focus on the strengthening to reduce the movement. So first exercise, you're on your side, it's very basic, and we're just bringing the leg up to about 45 degrees. We're trying to keep our leg parallel with our torso. Our stomach's in a little bit, so we're not arching. That's a big part of all the exercises with sacroiliac joint pain, is that we don't want to cause any extension in the lower back. So we want to do this exercise about 30 times on both legs, regardless what side the pain's on. And we'll do this 2 times a day. So that is a common exercise that a lot of people do generally, but if you are doing the opening leg exercise, I think people miss on strengthening the inside, the adductor muscles. So next exercise, we want to bring our left knee right over, and we want to be at right angles here. And then we're bringing our foot up for 2 seconds. So the lower leg and down. We're trying to keep it straight, parallel with our torso. Again, we're drawing our belly button in. If you can focus on keeping your pelvic floor engaged while you're doing this, that'll be good. It'll help stabilize the muscles as well around the pelvis. We're going to do 30 reps on both sides again. And then finally, I want you to do a stretch. We're just stretching the piriformis. You should, if you're going to bring your head up a little bit, have a small towel or a pillow here just to slightly flex. I'm just going to hold it up. And we're bringing this left knee to your chest. And I'm not very flexible, but I'm feeling a stretch all through the right glute here. And I want you to hold for 30 seconds and do this 2-3 times on both sides. So quite a lot of stretching after those 2 exercises. You run through that exercise protocol twice a day, and that will help stretch that piriformis muscle that is typically really tight with these sacroiliac joint issues. But the main thing is strengthening those muscles on the side and inside of the pelvis that will help stabilize those big sacroiliac joints that are probably moving a little bit too much and causing you pain. The next thing we want to consider is how we're holding ourselves when we're sleeping, what position we're sleeping in. A lot of people will sleep on their back or their stomach, and their stomach is going to be bad because you'll probably sink into your bed a little bit and cause extension into the lower back. That'll irritate the sacroiliac joints. And then if your bed is too soft and you're on your back, that forward flexion position where you might be sinking a little bit where your torso is into the bed, and that will strain the structures a little bit around the lower back and the pelvis. So I think for most people, the best position is to be sleeping on your side. And you want to be at 45 degrees in the lower back and 90 degrees at the knees, and have a small pillow between your knees. This should help with alignment, so your legs are then parallel with your hips. If you don't have the pillow, that top knee comes down a little bit, and it's not much, but because you are suffering from a sacroiliac joint sprain, there can just be a little bit more pulling on those joints when that knee is tilted down. So use a pillow between your knees and sleep in the fetal position. The last thing is the belt, and there are a number of sacroiliac joints you can buy out there. The main thing you're trying to achieve is just increasing that pressure from one, it's called ASIS on the front of the pelvis, pushing these AIS bones together. And that should help put the sacroiliac joints at the back into a better position, because this is all one big bone on both sides. And so we're helping reposition the sacroiliac joint a little bit better if we have this belt which applies pressure at the front. So I like the Sacroiliac belt, and a lot of people who suffer from this condition seem to think it's the best. I'm not really sure why. It's a little bit thinner than the typical sacroiliac joints that might be joint belts that might be a little bit more inexpensive, but for whatever reason, this one seems to work better. Maybe the Velcro is a bit stronger. So I'll leave a link in the description so you can find a Sacroiliac belt that might help. So that's it. Hopefully those exercises and the belt and changing your sleep position will help reduce or hopefully eliminate fully your sacroiliac joint pain. Cheers.